Hello guys, welcome to medicoiq. Now we will provide you information about hypertension, high blood pressure. Are you ready? So now let's get started.
Hey Sarah, I have suffering from high blood pressure. Dear, can you tell me the details of hypertension, because you're our doctor, so you know about the hypertension. Yeah, of course dear, why not? Hypertension, high blood pressure, is a disease of vascular regulation which increases arterial pressure above the normal range, and it is also called as blood pressure, and blood pressure reading are given as two number. First is systolic hypertension, equal the pressure in the heart as the heart contract. And second is diastolic hypertension, as the pressure in the arteries as they relax. Okay, and what's their normal reading? Hypertension is defined as average systolic blood pressure above 140 mm Hg and diastolic blood pressure is 90 mm Hg, or both over sustained period. It's called as a silent killer, because usually don't have any symptoms when blood pressure is too high. Oh. And what's their cause? There are two major types of high blood pressure. First is primary hypertension and second is secondary hypertension. Now I will explain you both hypertension. Okay. 1. Primary hypertension. It's due to unknown causes, means no identifiable causes, or without systemic cause. It's called as essential hypertension. Up to 95% of people have primary hypertension. Example: arterial degeneration, prolonged mental tension, hormonal and metabolic disturbance, family history, unhealthy dietary habit, increased salt intake, stress, tension, insufficient rest, smoking, obesity, tobacco, lack of exercise, excessive consumption of tea and coffee. Oh thanks dear. And what's the secondary hypertension cause? Secondary hypertension, it's due to pathological condition. It's called secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of hypertension, called secondary hypertension, tend to appear suddenly and cause high blood pressure than does primary hypertension. Example: kidney problem, for example pyelonephritis, endocrine disorder, e.g. diabetes mellitus, thyroid problem, congenital deformities, for example renal artery obstruction, excessive body weight, excessive sodium intake, illegal drugs taking, smoking. And what is their symptoms? Symptoms: hypertension is generally silent condition. Mostly hypertension has no sign and symptoms, but few people have a shortness of breath, a headache, chest pain, nose bleeding, epistaxis, dizziness, blurring vision, cardiac asthma, anginal pain, hematuria, palpitation, tinnitus. Okay thanks dear. I understand. Really, you provide me great info regarding hypertension. Please like, subscribe and share this video.